We're pairing with two community partners, Meridian Pediatrics and St. Vincent, and we're working with those two speech pathologists to look at their thickened liquids and how that is affecting the people that they serve in the community. And so we're really trying to master those recipes.
Because sometimes it can be inconsistent with the recipes they give you on the packaging, because different things like different temperatures or different brands can affect how it mixes. So we're just finding a recipe that works for different liquids and making a booklet for our community partners.
Because we don't want to give something that is too thin or too thick that will make the patient aspirate, which means that the liquid will go into their lungs and that could eventually cause pneumonia. So we want to try and find the correct thickness level that they can safely swallow their food or their liquid.
And so we are practicing a new procedure called IDSI testing, and that is an international standard that we're going towards for speech pathology, and it is just a syringe. It's a 10-ounce syringe, and we just let it flow out of the syringe, and based on how much is left after 10 seconds correlates with the number that indicates the thickness of it.
I think I've grown the most in my ability to work with other students, as well as problem solving and creative thinking. You think you know what the outcome will be, and you'll have a drastically different outcome, and I think that's a lot of times what will happen in any type of field. You'll have to kind of be on your feet for changes and being able to work with other people.
Before this, we had no real education on swallowing, because that's something that more happens at the grad level. So I think that just this class has kind of put us at a little bit of a leg up, just because we're going to be a little more familiar with it and a little more confident. And it has really opened my eyes a lot, because before I was like, oh, I'm not going to want to work with swallowing at all. But after this class, I've kind of gained a little more interest in it and could potentially see myself working with swallowing patients.
The immersive learning course allows you to have hands-on experience that I really feel like I'm getting experience in my major, and that will help me in my future. Here we're getting to work with our classmates who will be our colleagues one day and just really grow in the field, and I think that's really awesome about it.